Greetings and thank you for joining us today and our last webinar for 2016. And our title of our webinar today is What People with Parkinson's Disease Want Friends and Family to Know. We're very excited to bring this topic to you. This is the first time that we've had this webinar, and we're very much looking forward to a positive, open, and candid discussion with you today. So my name is Laura Gousset. I'm a physical therapist and an LSVT BIG trained clinician, as well as the Chief Clinical Officer and faculty of LSVT BIG for LSVT Global. I'll be moderating today's session and presenting part of it. I'm joined by my colleague Angela Halpern, who's a speech-language pathologist, also certified in LSVT Loud, the speech treatment, and is our Chief Clinical Officer of LSVT Loud for LSVT Global. So on behalf of our entire team, we thank you for taking time out of your day to join us. The objectives of our presentation today will be this, and this will outline what we're going to be going through today. We're going to list the common motor and non-motor symptoms of Parkinson's disease. We're going to discuss the perspectives shared by people with Parkinson's disease that deal with these common symptoms every day. We'll briefly review how the LSVT Loud and LSVT BIG protocols address those common motor and non-motor symptoms of Parkinson's disease. And then we're going to learn how caregivers can most effectively support improved speech and movement in people with Parkinson's disease who are receiving LSVT BIG and LSVT Loud. And lastly, we're also going to discuss the perspectives shared by family and caregivers of people with Parkinson's disease. Briefly, I'm going to go over the plan for today's webinar. First of all, let's talk about the logistics in case you haven't joined one of our webinars before. All of your microphones right now are automatically muted so that there's no background noise from the environments from which you might be joining us. You'll see in your control panel that there's a little section called handouts. If you click on that, the notes and slides from today's handouts are included in there, as well as a listing of our webinars which we've offered in 2016 and even prior to that. So feel free to print out those handouts and keep them for your personal reference. Also, just so you know, regarding the webinars, if there are other webinar topics that you're interested in, please be sure to visit the Patient Resources tab on our website, where you can find a whole wealth of previously recorded public webinars. At the end of the webinar today, we'll have some time for questions and open discussion, and we're really hoping that you take advantage of that time. You can start typing in your questions anytime in the question box that's on your control panel. And like I said, at the end, we'll go through those questions. There will also be an opportunity for you to ask your questions out loud as well. Okay, after that, we're going to present the webinar, and at the end, we will review the resources that are available to you. At the very end of the webinar, after you close out, there will be a survey that automatically pops up. We would love for you to take a few minutes to complete that survey. That gives us valuable impact as we plan for our webinars in 2017. We do have a few disclosures. All of the LSVT faculty have both financial and non-financial relationships with LSVT Global. The non-financial relationships include a preference for the LSVT BIG and LSVT Loud treatment techniques. Both Angela and I are employees of LSVT Global. And so with that, I'm going to turn it over to Angela, who's going to review the protocols and review some of the common symptoms of Parkinson's disease.
Thank you so much, Laura. Greetings. I'm very happy to be here with all of you today. One of the themes that we saw from the surveys that we sent out to people with Parkinson's and their caregivers regarding what do you want people to know was a desire for caregivers of people with Parkinson's to have a little more education and understanding of how Parkinson's disease affects movement and speech. So that's what we're going to start with today, is a brief overview of that. Next slide, please. When we think of the primary motor characteristics that we see in Parkinson's disease, the ones that we see noted are a resting tremor, so a tremor that happens when the hand, leg, arm is at rest, rigidity, postural instability, and then bradykinesia, which means slowness of movement, hypokinesia, meaning reduced amplitude of movement. Next slide. We see this hypokinesia, so this reduced amplitude of movement, affecting limb movement and movement related to the motor speech system. So what we see in relation to speech is this progressive loss of loudness, reduced loudness, a quieter voice, or what we call hypophonia. We see progressive loss of amplitude of handwriting, so micrographia, writing may become smaller. Progressive shortening of stride length and arm swing during walking. Some people will characterize it as short shuffling steps, decreased arm swing, and then this progressive loss of speed and amplitude, duration with repetitive movements of fingers and limbs. So we see this hypokinesia affecting across the whole body, the systems. Next slide, please. And what patients say is it takes a lot of effort to move bigger and to talk louder. And when we talk about LSVT big, moving big, LSVT loud, speaking louder, we're going to talk some more and get more in depth into this as we go through the presentation. But keeping in mind, we're just getting people to normal movements or normal loudness, but it may feel really big to the person or feel really loud. My patients will sometimes tell me that there's times that they know they need to talk louder, but on a scale of 1 to 10, it takes a 15 effort to get to the loudness they should be using. So that feeling of really taking a lot of effort to move or talk is very real. Next slide. Now, the motor symptoms that we just discussed are more obvious and often the most talked about, but it's also important to not forget about the non-motor symptoms and characteristics, which are listed here. And these are things that some people may notice, other people may not notice, but it's a list of items that people have noted that are reported to interfere with daily activities. And so these can include things such as sensory changes, subtle cognitive changes, depression, problems with autonomic abnormalities, so bowel and bladder problems, problems with vision. Some people report sleep disorders. And then with the cognitive thinking, it may be patients will say things like, I just feel like I'm thinking more slowly than I used to. It's hard to come up with words that I want to say. It's hard for me to keep my attention sustained or focused. And then some people may also notice some of these emotional changes, such as anxiety or apathy. And then some of the sensory changes, pain, tingling, burning. So these are just some things to be aware of because many times people just think of the motor symptoms that can occur in Parkinson's. Next slide. How do these non-motor symptoms affect speech and movement? Well, these sensory changes can affect speech in that people might have soft speech, but it feels like it's within normal limits. Or people might have smaller movements, but they feel like they're within normal limits. So many times my patients will say to me, I feel like my voice is fine, but I think my spouse needs a hearing aid. And then I'll play their voice back for them from a recording, and they'll hear that their voice is actually softer than what they thought it was. Or people may say things like, their movement felt fine. They see a videotape of themselves and say, I had no idea my arm wasn't swinging, that that movement wasn't there. And that's because some of the sensory changes that happen with Parkinson's disease. Next slide. And then how do these non-motor symptoms affect speech and movement? Again, looking at issues with internal cueing problems. So individuals, once they maybe have recognized, okay, my movements are smaller, my talking is softer, it's then difficult to come up with the cues on their own to get bigger movements or get to a normal loudness voice. So initially, what we might see is that those things can happen when people are cued externally. So if a therapist says, do this, people are able to do that. But then without rehabilitation and treatment, it's difficult for people to come up with that cue on their own to do those things. So sometimes people will ask us as therapists, well, isn't there an exercise program you can just give me to do at home instead of coming into treatment? And those are great for after treatment or during treatment, but we really see the need for behavioral intervention so people can learn how to do this internal cueing with that feedback from a therapist on their own. So comments like, if I don't specifically think about it, I forget to move big and talk louder. And then some of these subtle neuropsychological changes that might impact making it a little harder to shift sets, to dual tasks, to do more than one thing at a time. Next slide, please. So these are the things that are reported that you might see if you read in a textbook, but what is the impact that these have on the lives of people with Parkinson's disease? Next slide. What we did is send out a survey, some of you may have filled that out, and we asked people with Parkinson's disease and caregivers to give us their feedback. And so we're going to have several slides in this presentation that are going to be directly related to feedback that we had as a result of that survey. And the survey results were great and really served as a wonderful frame of reference for the presentation today. So some of the feedback about the impact of those motor and non-motor symptoms was this variability in function from day to day. And this can be frustrating. So people say, you know, there's days that things are easier, days that things are harder, and it's frustrating for them when other people feel like they're not trying on tough days. And, you know, they are trying, it's just that that day is harder for them. This increased effort. So as we were saying, thinking back to that picture of the person stuck in the mud, it just takes a lot more effort to talk and think about what you want to say. People said it's exhausting to have to think about moving correctly all day. And then a direct quote from one person was that thinking about this with the variability, it can vary from day to day. Even though they think you look fine or seem to be walking okay, you still have to concentrate hard to walk, really being purposeful with each step, and that's exhausting. And then another person said, just because I sound or feel good one moment doesn't mean I'm faking it other times. And I think that's some really great feedback and awareness for us. Next slide. Some of the other feedback are how challenging those off periods can be. And once again, it goes back to that variability and fluctuation, that what might be easy to do sometimes might be challenging other times. And then just this overall sense of frustration at having to repeat what you want to say, frustration at not being able to think of words, not being able to move as you want to. And then the outward difficulties with speech are not a reflection of the true person. And I thought this was a great bit of feedback to get as a speech therapist. I hear these types of comments from my patients as well. But, you know, I know from the people that I work with, they have amazing, important, intelligent things to say. And sometimes if it's difficult to get that started, or the speech is soft or difficult to get that out, that's not a reflection of how they want other people to see them. Next slide, please. So some general words of wisdom for those who wish to be supportive. So this came from people with Parkinson's disease, things they would like people who want to support and help them to know, things that would be helpful. Well, one of the common themes was listen, and that came up throughout. So just taking that time to listen. Be understanding in general. Be understanding that things may take longer. Be understanding of the frustration that a person with Parkinson's may feel. And also, don't take it personally if the person with Parkinson's snaps at you. Maybe they're having a really frustrating day and that's not meant to be directed at a caregiver personally. And then another common theme that came up was patience. So don't rush someone with Parkinson's when they're trying to come up with words. Let them speak at their own pace. As a speech therapist, I'd like to add to that last point that this is a really good item to have open communication about. So as a person with Parkinson's disease, discuss with your loved ones and your caregivers how much help you want or when you want help. There may be times of the day when you want to come up with the words on your own. There may be other times when you're feeling more fatigued and you'd like a little prompt or a cue of do you mean this or do you mean that. But it's good to have that open communication with those you talk with so everyone's on the same page, and that can decrease frustration. Next slide. And then some other general words of wisdom that we received, as I mentioned in the intro as I was starting, is that people with Parkinson's said they would like their caregivers and those around them to be really educated about Parkinson's, to understand what's going on so they can better understand what's going on with their loved one. Being persistent in involving the person with Parkinson's in conversation. So just because it might take someone longer to initiate a response or they may need to be prompted to stay loud doesn't mean they don't want to participate in the conversation. I know I've seen with people that I work with, they'll say that they sometimes just withdraw from conversation because it takes a lot of effort, or they may not realize that people can't hear them, so they feel like people aren't interested. That's not the case. It's just they're not getting that cue that they can't be heard. So once again, having open communication about this, being persistent in involving people in conversations. And then encouraging independence. Don't be overly protective. And we're going to talk about this. Laura will have a section at the end about how our principles through LSVT are really empowering the patient. She'll get into that more in depth. But once again, having that open dialogue of when do you want help as a person with Parkinson's versus when you want to try to do things on your own. Next slide, please. So the LSVT protocols that we're going to now get into were specifically and intentionally designed to address these deficits that we've talked about with the motor and the non-motor symptoms that are unique to Parkinson's disease. And the information that we receive from the surveys provides great feedback and insight into the impact that these motor and non-motor symptoms can have on daily life. The good news is there's something that can be done to help and address these challenges through the treatments that we're going to briefly go over of LSVT Loud and LSVT Big. So I'm going to briefly define what LSVT stands for if you're not familiar with it. So LSVT is an acronym for the Lee-Silverman Voice Treatment. And that was named after the first person with Parkinson's disease, Mrs. Lee Silverman, who participated in the voice treatment that's now called LSVT Loud over 25 years ago. So she was the first person who worked with Dr. Ramick and started on this treatment. It now has over 25 years of research data showing its effectiveness. And then LSVT Big was developed in the early 2000s based on the same principles and protocol of LSVT Loud. So LSVT Loud, speech therapy. LSVT Big, physical or occupational therapy. I'm now going to turn it back over to Laura, and we're going to do a poll to get an idea of the level of familiarity with these treatments.
Hi, thanks Angela. And so just give me one moment and I'm going to open the first polling question, and it is, if you're a person with Parkinson's, have you ever received LSVT Loud? And so I've opened that question, and please vote on it. I'll give you 30 seconds or so to do that, and then we'll see what the results are. Okay. And it looks like 78% of you said no, you haven't received LSVT loud, and 22% of you said yes, you have received LSVT loud. So that's great. Thank you for sharing that. We have one additional polling question here. And it's similar. If you are a person with Parkinson's disease, have you ever received LSVT big physical or occupational therapy treatment? I'll give you about 10 or 15 more seconds here. Okay. And the results say about half of you have received LSVT big and about half of you have not. So thank you so much for that information. That'll help us to tailor the rest of our conversation in this section.
All right, thank you for taking the time to fill out and answer that poll. That is very helpful. So as we go through the treatment focus, we're going to do some slides on LSVT loud and LSVT big from the standpoint of educating you on how these treatments can help to directly address and improve some of the impact that those motor and non-motor symptoms can have on Parkinson's disease. So the treatment focus for both of the treatments are, when we look at a snapshot, is that first we're working to increase the amplitude of motor output. So remember at the beginning I talked about that decreased amplitude across the system, and so we increase that amplitude, and that's by getting a louder voice and by getting bigger movements. Then through that of cueing to produce the louder voice and the larger movements, we're also working to improve self-perception and awareness. So helping people with that sensory aspect of seeing that when they get this amplitude, that it's normal loudness, that it's normal sized movement, and what is that amount of amplitude required so that people can learn to do that on their own. And so then we really are bombarding improvement in self-cueing and attention to action. So helping people then be able to produce the normal loudness voice, the normal movements without cues from the therapist, and be able to internally cue that. So then it becomes this positive circle of independence, of people being able to do this on their own without those cues from the therapist. Next slide. So the LSVT protocols are intensive, and when we say intensive, if you haven't had the treatment yet, intensive isn't meant to be a word to scare you, but it's meant to be a word to show you how the treatments are different and why they work. Intensity of treatment is key to motor learning and neuroplasticity, and by neuroplasticity we mean the brain's ability to make change. And so sometimes traditional treatments that weren't as intensive, only maybe things that happened a couple times a week, maybe weren't as effective. We really see this intensity as important for individuals with Parkinson's disease. So the treatments are delivered 4 days a week for 4 weeks. The sessions are 1 hour in length, and then you're given daily home practice, and that really shouldn't take much more than 5 to 10 to 15 minutes a day, and daily carryover exercises. Those are so important when we talk about increasing the independence and the person's ability to do these exercises outside of the treatment room on their own. And we're also really helping to establish a lifelong habit of practice. So we want people to shift to thinking about exercise as medicine. This can be a nice addition to your platter of I take my medications, I do my exercises. Next slide. So why is this necessary when we look at the intensity and the programming of the treatment? It's necessary to address these non-motor symptoms of the apathy, the slow processing, the motor planning, motor learning, and then the motor symptoms of this deconditioning that can happen with Parkinson's disease, weakness that people may report, postural changes. So we really need this intensity to directly address and bombard and make changes in this non-motor and motor symptoms. Goal being bigger movements, louder speech, more normal movements and voice production. And this needs to become overlearned. That's how people will make change, and change that they can generalize and continue to utilize on their own. Next slide. It isn't just about the amount of treatment, however. It's also about how hard you work during the treatment and after. Next slide. So you must keep up the intensity within the sessions, and the therapists are very well trained in how to help you keep up that intensity within the sessions. And this is done through high effort. So always working on increased amplitude, so keeping it big, keeping it loud for that 60 minutes of the session. Multiple repetitions, so we see those repetitions are necessary to make change and to help you learn and be able to carry over. As people continue to improve, we're always increasing the force and the resistance used, so people can continue to make these improvements over time and always be pushed to higher effort levels. People are very familiar with the analogy of, you can think of a personal trainer working with someone in a gym. They're not just going to let the person do one repetition and then stop and take a sip of water and relax. You need to be pushed to make change. And we see that with LSVT loud and LSVT big. And we also see that people of all levels of severity can participate in the treatment and are able to participate in the exercises. The therapist push a certain level of accuracy to get that target of not only a louder voice, but a louder voice that's produced in a healthy way with good quality, movements that are produced in the correct way. And then people do get fatigued, but that's important in the treatments actually, to be driving this healthy level of fatigue. And so as a speech therapist, when I'm done a session, if someone says, whew, I feel like I've had a workout, I'm like, great, I know I'm doing my job. I know I'm pushing people like I should to make change. Next slide. So the motor is clear. That's how we push the motor system, but it's also very important in LSVT big and LSVT loud that we address the sensory system. So we help people learn how to self-monitor the proper amount of amplitude to get the normal loudness voice, to get to those normal movements. And it's important for caregivers of people with Parkinson's to realize that this can take time. This is why we meet 4 times a week for 4 weeks, so we have time to make these calibration changes for people to learn to do this automatically on their own every day. So we're addressing, next slide please, these barriers to generalization in each of our sessions. So we're bombarding that sensory mismatch. So what we see is people with Parkinson's disease may have soft speech, but it feels like it's within normal limits. And that's because of the sensory mismatch. And then when I get my patients to normal loudness, many times they'll tell me, I can't talk like this, I feel like I'm shouting. So we do a lot in the treatment session with recording and feedback so that people can see this voice isn't too loud, it's really a normal loudness level, and people can hear and understand me, and I'm not shouting. And same thing, we see that with movement. We're addressing the sensory disorder of people feeling like they're moving too big. And they can see through videotapes, nope, I'm not too big, this is normal movement, and this is what it takes for me to move more safely and at a more normal speed. We're addressing that internal cueing, so the physiological substrate for movement is present, but it's not being activated. So what that means is initially, like I was saying at the beginning, people can be cued to walk bigger or speak louder, but without the cueing, it's hard for them to continue on their own. So an important part of the treatment is that internal cueing, helping people to see how to activate that and how to do those larger movements, louder speech on their own. And then we're helping people with these subtle neuropsychological changes that might be going on, and the treatments are addressing a singular focus of think loud, think big. So it's a simple focus, it's not too complex, but it can make a wide variety of changes. It's important with this sensory disorder to understand as a caregiver how odd this feels to the person with Parkinson's. So imagine if we asked you as a caregiver to use a voice like this: "I want a pound of roast beef," at the deli. That would feel funny to you. Well, that's what the person with Parkinson's disease feels like every time we're asking them to get to normal loudness. Or imagine if we asked you to use big, exaggerated movements. You can almost picture what the Pink Panther looks like when he walks. That's how a person with Parkinson's might feel when we're asking them to think big. So as caregivers, when we talk about the importance of education, this sensory disorder is really important to understand. Next slide. So signs of successful calibration are when my patients report to me the functional impact of using this normal loudness voice outside of treatment. So I used my loud voice on the phone. I didn't have to repeat myself. I was heard and understood. When people say they're remembering to move bigger on their own, that they're not needing the therapist to remind them. When our patients say it takes less effort to be able to speak at normal loudness or with those larger movements than it used to. Next slide. So the level of calibration is reflected in how automatic the bigger movements or the louder voice is in daily life. So for people who are more in the early stages of Parkinson's, this may happen a little more spontaneously, easier for people to self-cue without those cues from the therapist or others. The mid stages, people may need a few more cueing from those, or may need more of the familiar environments to help them to remember to do the larger movements or the louder voice. And late stages may be more cued by the caregivers and those in the environment. But at all stages, people can be able to make change and have a functional impact. So these levels are really general estimations, not absolute. So sometimes people with later stage Parkinson's disease might be more cognitively intact to self-cue, or people with earlier Parkinson's disease might show more difficulty with this. So it's really individual, and in LSVT loud and LSVT big treatments, everything is personalized and individualized to the goals of that person. It's also important to understand for caregivers that home can be the hardest place for someone to remember to carry over the larger movements or the louder voice. So sometimes as a therapist, I receive comments of, well, he can remember to be loud when we're with a group of friends, but he doesn't stay loud with me. And sometimes that makes the spouse or caregiver feel unimportant. But please keep in mind, this isn't the case. Rather, home is where the person feels the most comfortable, so it might be harder to remember in the home environment to use those movements or be louder. And also from a speech standpoint, home is usually quiet, so there aren't those external cues to bump up the loudness. So I'm now going to turn it over to Laura, and she will dig into talking about the role of spouse and family and provide more information on the survey feedback.
All right, thank you, Angela. Yes, so it is true that caregivers are very important, but let's talk more specifically about what the role is of the spouse or family or other caregiver. And the operating principle with LSVT big and LSVT loud is we want to empower the patient first. That's our ultimate goal. And so because of that, as a family member, a spouse, or a caregiver, you might not be immediately included in the treatment intervention with that patient. It really is variable and individual from patient to patient. And if the therapist says, well, you know, right now I just need to focus on the patient with Parkinson's alone, it's not to exclude you, but it's for meeting this goal of really empowering the person with Parkinson's disease. we want that patient to be the one to take responsibility, because then they are the ones that reap the rewards of improved self-confidence. You see the snapshot of the gal on the left doing her big exercises, and yes, it takes a lot of work, it's a lot of effort, but the end result of being responsible for working hard, doing those exercises and therapy and at home might be that person feels more confident now to be able to go out and take a walk or walk the dog on uneven terrain or in different weather, something that person might not have felt confident to do before therapy. And so we say the patient does it so that they receive the rewards. They're not doing it for their spouse or their family. It's because they value it for themselves. But sometimes the family is necessary. There are patients that have physical difficulties and might need coaching with the exercises, might need physical assistance with walking, activities of daily living like dressing or showering or using the bathroom, or might need some cues, some reminders throughout the day to help them to remember to use their louder voice or bigger movements with function. And in those cases, the LSVT big and loud therapist will really include you and teach you how to best help that person. Sometimes the family is desirable as well, and by family we also mean to include friends and caregivers and other people that are involved in the lives of people with Parkinson's disease. And so very often we see wonderful, wonderful support teams out there that really help patients with Parkinson's to be encouraged to do their exercises, to give it all they have. So they're cheerleaders. And we all know that life with Parkinson's is not easy. There are many challenges. There can be difficulties with just having that get up and go that you used to have. And so in these instances, it's wonderful to be surrounded by a team of people that will help to encourage you and support you. These are some recommendations specifically from LSVT Big and LSVT Loud expert clinicians. If they recommend that you serve as a coach for that person, one of the things that you'll for sure want to do is learn how to do the exercises correctly so that you are able to feel the effort it takes to be bigger or be louder with your movement. You'll also have to learn how to correctly model the movement so that if the person with Parkinson's is watching you to do their exercises correctly at home, you yourself as a coach is doing them correctly and safely as well. One of the other key elements about the LSVT protocols is to really keep it simple. Keep the focus on just big or loud, and limit your words. For therapists and for caregivers, this is one of the more challenging things to do, because if the person with Parkinson's isn't doing something quite right, it's easy to get complex or very over-explanatory, such as saying, you know, you need to sit up straighter, you need to turn your hand up, you need to, you know, open your mouth larger, and on and on and on. And pretty soon those instructions just become very overwhelming, and it diffuses the focus from amplitude. Here are a few other recommendations if you're going to be serving as a coach. Recognize that people with Parkinson's disease oftentimes need more time to process the information. And so if you're modeling an exercise, for example, or giving a person a reminder to use their louder voice or bigger movement, and they don't do it immediately, it's probably not that they didn't hear you. They're just processing that bit of information and working to initiate the movement that you've requested of them. So give it some time, and oftentimes you'll see that that person indeed will be able to do that successfully on their own. This goes with physical activities as well. Sometimes the person with Parkinson's is indeed able to get up out of the chair, for example, on their own, but needs a few minutes to initiate, not a few minutes, but maybe a few seconds to complete that movement. So before you jump in and give physical assistance, see if they can do it on their own, if they're just given a little bit more encouragement and a little bit more time. Some of the key feedback that we receive from you and also that we've observed as clinicians is the more positive and encouraging yet compassionate you can be as a caregiver or as a family member, the better. Seek to understand how those problems with sensory awareness and perception are affecting your loved one. For many therapists, before they got trained in LSVT Big or LSVT Loud, they were really unaware of this sensory problem with Parkinson's disease. That was new information to them. And so for caregivers and family members, that's also new information that, gosh, I didn't realize that he didn't notice when his arm wasn't swinging. I didn't realize that he couldn't tell when he was leaning to the side or when he wasn't talking loud enough. And so when you really understand that sensory perceptual problem, I think that gives you empathy and compassion, why it's not easy then to always correct that if they're not aware of that. And lastly, please ask questions. The therapists that are helping people with Parkinson's are very eager to help not only the person, but also the team of people that surrounds them on a day-to-day basis. So bottom line, it's your persistent and positive energy that gives confidence and power to move big and to talk loud. How can family and friends and caregivers be most helpful when people with Parkinson's partake in LSVT Loud and LSVT Big? Here's some of the feedback and suggestions that we received from you through the surveys that we sent out, and we'll separate them into some themes. The first and most redundant thing that we heard was encouragement is the best gift. Encouragement is not nagging, but encouragement to practice their exercises every day is so important. A lot of times, all of us don't feel like exercising. You know, some days we're more tired or just don't feel that great, and it really is helpful to have a friend or a loved one come along and say, come on, let's do it. Let's do it together even. That's been very helpful for spouses, for example, to do the exercises together, and it's kind of a win-win because they both get some voice or some body exercise. If you're not able to do the exercises, you can be a cheerleader. You can set the schedule. You can time them and say, gosh, you know, you're doing great. You did your exercises in, 20 minutes instead of 25 minutes. You must be moving faster. Don't belittle the person with Parkinson's as you're encouraging them. And here's a few direct quotes that I'd like to share with you. One person said, my wife is very knowledgeable and supportive. Rather than getting discouraged, she incorporates new lessons without complaint and makes it easier for me to remain committed to my exercises. Another quote was encouragement. It's the best gift. And then one more said, that's great, honey. You're moving better and speaking better every day. Some other suggestions for people that wish to be supportive of their loved one or spouse that has Parkinson's disease. Give them support, empower them, give them feedback that's honest about how they're doing. So if you notice that they're doing something better with their voice, with their movement, with their posture, don't keep that to yourself. Really provide them with that feedback so that they know how they're doing. Become educated about the LSVT treatments. You can do that through your therapist. You can view some of our webinars. Those are all excellent ways to learn a little bit more about specifically what the person with Parkinson's learns during LSVT treatment protocols. And then be patient is one of the other recurring themes that we heard quite frequently from people with Parkinson's. A few specific quotes to share with you. One person said, come and visit during the last session and see the improvement that I've made. Another person says, encourage me to do it at home. Do it with me, time me, give me encouraging words. And lastly, one more person said, patience in the whole process is very, very important. So on the other hand, what do family, friends, and caregivers of people with Parkinson's want to know? Another key element because it really is a partnership between the caregiver and the person that has Parkinson's. So patience is required on both ends. The caregiver requires patience as well. Some of the feedback that we received was the caregiver can only do certain things at certain times of the day. They have a lot on their platter, and so they have to manage and delegate their time to various responsibilities. Caregivers can get tired too. Caregivers are not trying to take away independence, but sometimes they need to foster safety. And so I'd like to share a few additional quotes with you on this theme. Please understand how everything I do revolves around what's best for him. How constantly I am aware of where he is and what he is doing and what I could do to help. Another person says, I wish my husband understood that some days I'm simply tired, but I do try to understand how frustrating Parkinson's disease is for him. He often comments about the fact that he has to think so much before he walks, a guy that was once a superior athlete. And a couple other quotes. One person says, my loved one's behavior changed and I wasn't able to do total care for him anymore. And he doesn't understand that it was his change in behavior that led me to not being able to physically care for him at home. And lastly, it's kind of the same theme. I wish he understood that it was for his own safety that he not try to get up and walk for us. And so sometimes additional hired help is needed, and sometimes there are restrictions on activities if a person has safety issues with mobility or judgment as well. One of the most important things that you can do between a caregiver and the person being cared for is to establish and keep an open line of communication. So as a caregiver, you want that person with Parkinson's to talk more about their feelings and their struggles and their discomfort. And a lot of the caregivers that we receive feedback from said they really do want to be able to understand the pain and the movement challenges, the fears and frustrations from people with Parkinson's disease. A couple of quotes from that. One person says, I wish he would talk more about how it feels to be more dependent when he was very independent before and physically strong before Parkinson's disease. I wish I could understand the pain and movement challenges that my husband experiences, the less visible one than the exterior tremors. And one last one says, I wish I understood why he doesn't ask questions about how I feel physically and emotionally. So with that, we would love to turn it over to maybe 5 or 10 minutes of an open mic time before our wrap-up begins. And let me just kind of tell you how this open mic time works on GoToWebinar in case you haven't been with us before. There are 2 different ways that you can ask questions or give responses. One is on your control panel, you'll see something that probably says questions. If you type something into that box and submit it, I will see it on my end and I'll be able to read it out loud to the group. And please know that that is an anonymous way of providing feedback or asking a question. The other way is to raise your hand. You might see a little hand icon on your control panel. And if you click on that, I'll see that your hand is raised. I'll go ahead and call out your name and unmute your microphone so that you can ask your question out loud, and either Angela and I will address that question. So to guide our discussion time here, and we really do hope that you are feeling comfortable to interact with this, we've established a few questions here. One of them is, what advice would you like to share with other people who have Parkinson's disease who have not yet received LSVT Loud or LSVT Big? The second question is, what recommendations would you like to share with other family, friends, and caregivers of people with Parkinson's disease? And lastly, if you're a caregiver, a friend, or a family member of someone with Parkinson's disease, what words of wisdom would you like to share with other people? And so with that, feel free to provide any responses for any of those questions, or maybe you have a question of your own or a different comment that you would like to supply. And we'll just give you a few minutes here to type in and submit your questions, and we might have a couple of minutes of silence while we're waiting for those questions to come in. So we'll just wait for that for a couple of minutes. Okay, so we've given it a couple of minutes. I don't see any questions coming in yet, except for just a question about finding a clinician and updating the website listing. So just know that right now we have a Find a Clinician tool on our website so that you can type in your zip code, which is usually the best way to find a clinician, or you can type in your city and state if you're in the United States and find an LSVT Loud or LSVT Big certified clinician. However, if you find a listing that is out of date, please alert us by calling our office or emailing us at info@LSVT Global so we can get that taken care of. Sometimes clinicians change jobs or are not practicing LSVT anymore, so the cleaner that we can keep our database, the better with your help. If you're ever having problems finding a clinician and there's not one listed in your area, also please do contact us, and we'll be happy to see if we can help you find a clinician in your area. I think there is maybe one other question that just came in about, do you provide this program in Spanish within the United States? Great question. And so really, I think two ways to answer that. The therapist, of course, if they're bilingual, can offer this therapy treatment in any language that they're fluent in. In terms of the treatment materials, at this point, we don't have Spanish translated materials for patients, but this is something that we're actually talking about doing in 2017 because of the need. The great many patients that we have that are Spanish speaking throughout the world. So if you think of any other questions beyond this webinar, please email us at info@lsvtglobal.com, and we're always happy to answer any questions that you might have or receive any feedback that you have as well. So in summary of today's presentation, we're in this together. We're in this together between healthcare professionals like LSVT Big and LSVT Loud certified clinicians, doctors, nurses, and we're in this together with a team of people that support people with Parkinson's disease as well. It's very important to have an open dialogue between therapists, people with Parkinson's, and caregivers so that we can support the person with Parkinson's throughout their journey in the best way possible for them. And we really, really have the highest admiration for people we meet daily who are working hard to enhance and improve the quality of life and the quality of life for those that they care for. Angela and I were just really touched by the open and honest feedback that was given through the survey that we sent out last week, and we truly thank you for taking your time out of your day to answer that survey and respond to those questions. We really admire not only the people but also the family that supports them and encourages them on a day-to-day basis. So lastly, if those of you who haven't received LSVT Loud or LSVT Big are interested in doing so, it's quite easy. Step one is just to ask your doctor for a referral and a prescription to physical therapy and occupational therapy for LSVT Big or for speech therapy for LSVT Loud. If you go on our website, you can find a clinician in your area, hopefully, who can deliver this treatment. If you can't find a clinician, sometimes it's patients who really educate the therapists on this treatment option and encourage them to get certified. And we offer our certification and training to therapists through live workshops and through an online program. So in as little as 2 days, they can get certified to deliver the treatment themselves. We do have what are called homework helper videos that are available in DVD format and also can be downloaded or streamed through Vimeo. And you can find those on the LSVT Global website under products, or you can find them on Amazon.com by searching LSVT Loud or LSVT Big. Those are excellent ways to introduce you to the voice and movement exercises and to keep you motivated as you go through the treatments and after treatment as well. So for some further information and resources, we have a lot of videos that you can watch on our website. I've already mentioned the free webinars. And for those of you that have gone through LSVT Loud and need a little bit of extra motivation and fun in practicing your exercises every day, there is also a software program called the LSVT Loud Companion that you can learn about through our website. So with that, we truly want to thank you for joining us in today's webinar. This was the last webinar of 2016, and we hope that you were able to join other webinars this year. If not, we look forward to seeing you again in 2017. After this webinar closes, please do take a couple of minutes to complete the survey that will launch, and it will take less than 5 minutes to complete. So thank you so much, and we hope the rest of your day is fantastic.